Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
disease modifying anti-rheumatic drugs, DMARDs. So these DMARDs, first we have immunosuppressants. The immunosuppressants which can be used as DMARDs are, these include methotrexate, leflunomide, azathioprine, cyclophosphamide, cyclosporin, cycloserine, mycophenolate mofetil, sulfasalazine, chloroquine, and gold compounds like gold sodium thiomalate or auranofin, and also D-penicillamine. So all these are immunosuppressive agents which can be used as DMARDs. Methotrexate, leflunomide, azathioprine, cyclophosphamide, cyclosporin, cycloserine, mycophenolate mofetil, sulfasalazine, chloroquine, gold sodium iothalamate, then auranofin and D-penicillamine. Penicillamine. Then biological response modifier. Biological response modifiers include tumor necrosis factor antagonists like etanercept, infliximab, and adalimumab, sertolizumab, and also golimumab. So TNF alpha blockers like etanercept, infliximab, adalimumab, sertolizumab, and golimumab. Interleukin 1 antagonist like anakinra. Interleukin 6 antagonist like tocilizumab. CD20 monoclonal antibody like rituximab. T cell inhibitor like abatacept. And also adjuvant, we can use corticosteroids, can also be used as adjuvants like the drug prednisolone.
thank you and thank you for watching.